Hello, I'm Emma Howard and I'm joined by Dr. Jonty Heaversedge, who's an expert on men's health problems. Hello, Jonty.
Hi, Emma.
Got a question here from a young man who's recently got engaged to his girlfriend of 6 months, but his ex-girlfriend has told him that she's pregnant with their child. Now, he's clearly doubting whether it is his child because he wants to know how he can get a paternity test.
Okay. I mean, this is a difficult one because obviously there are implications in having a paternity test for him, for his ex-partner, for his current partner, and most of all, I guess, for the child. And that's really important to remember if you're ever organising a paternity test, is actually there are really important implications for the child in the middle of all of this. Now, he's concerned about getting a paternity test. They are available. They tend to involve either a swab of some cells from inside the cheek or a blood test. You can get them, but I'm afraid they're not available on the National Health Service.
So you'd have to pay for it?
He'd have to pay for it. His GP may be able to help to identify a local centre that offers paternity testing, but otherwise if you looked on something like NHS Direct, they've got a list of approved testers, but unfortunately it is something you'd need to do privately.
And you talk about the implications. What do you mean by that?
I think just that obviously in terms of his current relationship there are implications for that, but also in terms of the child. If you just always try and think about the child and what it will mean to the child to know who his or her parents are, I think that's what you've got to keep sort of central to your thinking when you're going through a process like this.
Yes, knowing that the father had denied perhaps that he was the father.
Absolutely, yeah.
So would it help him if he went, could he go and talk to his GP about it, that whole procedure?
Absolutely. Just because the test itself isn't available on the National Health Service doesn't mean that actually, you know, it's not something that GP can talk about the emotions involved, can give useful advice, and obviously can then also go on to suggest where you might go to get it done.
Very good advice, Jonty. Thank you very much indeed. And if you have a similar problem, we hope we might have given you some help. But remember, it's always best to go and see your own doctor for medical advice. Thanks for watching. We'll be back with more health questions and answers.